Hello friends, good morning. Today I am again with a new topic, that is breastfeeding, and this topic is very important, and I'll advise just please see my video till the last to learn something from this important topic. This is Dr. Sharjit. Let's begin. Today's topic is breastfeeding. Let's first see what are the hormones that are involved in breastfeeding. Main hormones. These are oxytocin and prolactin. These are mainly responsible for lactation. And now come to the topic colostrum. Friends, what is colostrum? Colostrum is the first secretion from the mammary glands, that is breast, after giving birth to the baby. Okay, so this is the first secretion that is expressed from the breast after childbirth. We have to give this feed to our child, to our baby. And this colostrum has low fat for easy digestion. It contains mother's antibodies which boost infant's immune system. It acts as a laxative to ease passage of meconium. Now friends, let's see what are the breastfeeding benefits to the mother, that is mother health benefits. So in female, what happens if they are breastfeeding to their child? The advantages or the benefits are less postpartum bleeding, more rapid uterine involution, weight loss. Breastfeeding burns extra calories, so helps to lose pregnancy weight faster. Breastfeeding decreases premenopausal breast cancer rates. Breastfeeding decreases ovarian cancer rates, and it also acts as a lactational amenorrhea method of contraception. Before proceeding to lactational amenorrhea, let me first give you some advice that in spite of lactational amenorrhea, one should use progesterone only contraceptives also, or combined contraceptives cannot be used because it dries up the milk. Now let's understand what is lactational amenorrhea. Lactational amenorrhea. What is the meaning of amenorrhea? Amenorrhea when the woman is not having their periods. And lactational means you are breastfeeding and you are not getting your periods. That is lactational amenorrhea. Okay, so what is lactational amenorrhea? It is a temporary family planning method that is based on breastfeeding. It can be effective for up to 6 months after childbirth. Here, baby is fully or nearly fully breastfed and is often fed in day as well as in night. What is the meaning of fully breastfed? Fully breastfed meaning exclusive breastfeeding, that is no other liquid or food, not even water. So baby will only take breast milk, nothing else, nothing extra, no water at all. So this is called as fully breastfed baby. A nearly fully breastfed baby, what does it mean? It means that infant or baby receives some liquid or food in addition to breast milk. But the majority of the feedings, that is more than 3/4 of all feeds, are breast milk. So in nearly fully breastfed infant, they should take more than 3/4 of their feed in the form of breast milk. So this is called as nearly fully breastfed babies. Okay, now friends, let's come to the benefits to babies. What are the benefits of breastfeeding to the babies? So, breast milk is more digestible than formula fed. Formula feeding increases baby girls' risk of developing breast cancer in later life. Formula feeding is associated with lower IQ. So, breast milk is good for good IQ. Breast milk is always ready and comes in a nicer package than formula feed. Breastfeeding satisfies baby's emotional needs and increases bonding between mother and baby. Breast milk provides perfect nutrition to the baby. Breastfeeding protects against Crohn's disease. Crohn's disease is an intestinal disorder, so breastfeeding is protective against Crohn's disease in babies. Formula fed babies are more at risk for developing obesity and being overweight in later life. Formula feeding increases risk of children developing diabetes in later life. Breast milk contains immunities, immunities to diseases and aids in the development of baby's immune system. So it contains many antibodies that is transferred from mother to the baby in the breast milk. So this breast milk is very good for the immunity of the baby. To develop the immune system of the baby, this breast milk is very good. Breastfed babies have less chance of cardiopulmonary distress while feeding. Formula feeding increases chances of baby developing allergies. Breast milk lowers risk of baby developing asthma. Formula feeding increases baby's risk of otitis media. Otitis media, this is an ear infection that happens in the baby who are formula fed. So breastfeeding is protective for this infection. Formula feeding may increase risk of sudden infant death syndrome, whereas breastfeeding is protective. Breastfeeding protects baby against diarrheal infections. Breastfeeding protects baby against bacterial meningitis. Friends, what is bacterial meningitis? That is meningitis that is caused due to bacteria. So what is meningitis? Meningitis is acute inflammation of the protective membranes covering the brain and spinal cord. And most common symptoms are fever, headache, neck stiffness. Whereas this condition is very dangerous to the children. It may lead to coma as well. So breastfeeding protects baby against bacterial meningitis. Formula fed babies have a higher risk of developing certain childhood cancers. Breastfeeding decreases chances of developing rheumatoid arthritis in children. Preterm mother's milk. What is preterm mother's milk? Whether this preterm mother's milk can be given to the preterm babies. Friends, what is the meaning of preterm? Preterm is when the baby is born before 37 completed weeks. So, when the baby is born before 37 completed weeks, that is called as preterm. And term is when baby is born after completed 37 weeks. Okay, so this is the question, whether we can give preterm mother's milk to the baby and whether is it sufficient for the baby. So friends, yes, preterm milk is sufficient for the baby and it is good for the development of the baby. Preterm mother's milk has more protein and higher levels of many bioactive molecules as compared to milk from women delivering at term. Breastfeeding decreases child's chances of contracting Hodgkin's disease. Breastfeeding protects baby against some visual defects. Breastfeeding decreases chances of osteoporosis in children. Breastfed babies have less chance of developing necrotizing enterocolitis. Friends, breast milk is free and non-expensive, whereas formula feeding is expensive. So breastfeeding is anytime good for the health of your baby. Breast milk acts like a natural tranquilizer for your baby. Breastfed babies are healthier overall as compared to formula fed babies. Fresh breast milk is never contaminated with bacteria, whereas formula feeding is most of the time contaminated. Breastfed babies have less tooth decay. Now friends, let's come to the question that how we can store breast milk. First question is whether we can store breast milk. Yes, we can store breast milk. After expressing the milk, we can store this milk. So, till what time we can store, that is the question. So, let's see till what time we can store breast milk. Breast milk can be stored at room temperature for 6 to 8 hours. In refrigerator, not more than 72 hours. In freezer, not more than 2 weeks. Okay, thank you friends. I think this video is very useful for you, for those mothers who are very much bothered about breastfeeding to their child. So let's see what is the effect of this video on your habit of feeding your baby. So for those mothers who are not feeding their baby, means not breastfeeding their baby, this is very useful, I think. And I'll request you all to please subscribe and like my channel, and please see my videos, because I'll come forward with many other videos about obstetrics and gynecology topics for general public as well as for students. Thank you.